Thanks very much. I'm just going to focus on two areas, and I'd be interested in the responses from both organisations, because in a sense, while there's both organisations, you're absolutely at idem about the multifaceted nature and that kind of trinity of the mental health, physical stuff, and the drugs and whatever. That's, I shouldn't say impressive, but it's very important to hold those three things together, and it's so nearly all of the population that are caught up in one way or another, in many ways. So my two questions are, and I should, before I say I apologise, I'm going to have to leave later on, so forgive me if I'm not. I should be here for the answers to this, but forgive me that I have to leave earlier before the meeting closes. Niamh, the causal and consequential. You raised that one. I'm interested in the responses from both of it. Is there some kind of what's the ratio or the impact of causal things, and what are the consequential things that come on the back of sheer homelessness? Yeah. And the other question, and I suppose Fiona there at the very end talked about a health strategy in isolation to housing isn't going to do it. And that's a hint to me to talk about the things that are beyond health, that clearly housing is one of them. What other things help or hinder, maybe along with that one? I think obviously that's the big one. And within the health area, we've already, to go back to the physical, the mental health, the drugs and all the rest of it. So is there, how will I frame the question, how well within the health area and across public services generally, how well or efficient are coordinated responses and timely responses? It's really, how does the system in the round come to the aid of people when it's most needed and can be most effective? Sinead Wilcock here, look, thanks very much.
Thank you.
Just on the point of coordinated responses, like one of the key things, because of the complexity and nature of the issues that we're dealing with, is the admission from all of us that nobody can do it on their own. You know, it is a very complex issue, so it requires a very coordinated response. In some respects, there's been a lot of innovation. A lot of it has come from within the sector itself, through Safety Net and the adult homeless team in Cork as well. And I think we have an example and templates of stuff that actually does work. We just don't have enough of it. And one of the examples of that is, like, for example, you've got the Adult Homeless Integrated Team, which is part of the HSE Adult Homeless Support Network within the main hostels in Cork. And with that, then you've a link with the adult addiction services through working with the Cork Local Drug and Alcohol Task Force. The key thing is you have lots of people in the same area around the same table. So they're communicating, they're working together. You're adapting to the circumstances as people present. And one of the key things we've found about, particularly in terms of health impacts and positive health impacts, is accessibility. The reason we set up in the first place around day services and stuff like that was because people weren't going to the accident and emergency services unless it was too late. And sometimes they went in extremis, and sometimes they were not in a position to be waiting, and they create problems in the A&E and stuff. And obviously those services are under enough pressure. The idea was to bring the services to them, make it easily accessible, and that's the stuff that works. And I know Austin has mentioned the stuff earlier about the Hep C screening and so forth. And it is that type of thing about the adaptability and the wider health services to, you know, become more a part of supporting those type of initiatives, because they do work. In the longer run, it is more cost effective, because a lot of the people that we've worked with, and we operate those type of systems as well in Cork, where people, you're managing people in terms of, you know, they're not going to give up drinking, but you're trying to manage their drinking and keep them safe and keep everybody else safe as well. And in doing that, the key really is understanding the nature of the issues and then finding a response that will meet the particular needs. Now, we're not dealing with homogenous groups in lots of cases. Lots of people are very individual. Their needs are very individual. So the the system needs to be able to adapt to those type of circumstances, because it is about people, and you can't separate out the mental health, the polydrug use and so forth. It's become far more complex now in terms of dealing with those type of issues. But the other thing about it as well, if we talk about harm reduction, there's no point in saying to someone, don't do something if you don't offer an alternative. And part of that alternative we've been saying is, like for example, the activities programs. Whatever somebody's interested in, if we can intervene in a particular, whether it's 2 hours or a full day's activity, without somebody actually going and drinking or using, then that's a really positive step, and it opens up opportunities for the future. Similarly, for example, moving people along a continuum of access to education, training and work. And like I said, this is a complex issue. Everybody has a role to play. We have direct links with employers to get people into employment, on work programs, on work placements and so forth, and all those things work. Similarly with the aftercare, provision of aftercare services and supports, the difficulty we find is that we're providing a lot of these, but we're not getting any support for them. They're not actually funded. We're having to fundraise to provide what are essential services in the continuum of care provision and support for people with mental health issues, addictions and so forth. And yet we know that they work. So there is an opportunity to deal with these. And I think it's important that when we look at those type of things, that we look at what works and what works effectively, and then we adapt the programmes to suit those particular needs.
Is it fair to say that the things you're saying, you're fundraising, these connect and moving people on things, are they things that are a key responsibility of other public bodies?
Well, I think they're everybody's responsibility. Yes, they are, to be honest, right? But like the difficulty is that when you're dealing with people with particularly challenging issues, not everybody wants to move into that space, and I think that's the problem. But we've found ways to deal with that and to make it work, and I think they're the type of things that need to be supported.
But my question, I suppose, are public bodies coming? I understand the halfway house concept, if we call it that people need. You have to bring things to, but public bodies, are they responsive enough to actually be coming half the way, or to be delivering services in a different way? You gave the example of the Mater bringing the Hep C thing to where folk were. That's someone figuring out a new cultural change thing. Is that?
I think there's more to be done in that. There's no doubt about it. Like everybody has a responsibility, whether it's DSP, local employment services, and so forth. The difficulty is that the people we're talking about have fallen out of those systems.
As they're being provided, in the way they're being provided.
In the way they're being provided. So we're having to fill the gap. And you've got to look at this in terms of being able to solve the problem. If we want to support people to move out of homelessness, one of the key factors, and Dr. Austin mentioned it earlier, is financial stability and people being able to support themselves. So getting people back to work is part of that. Some people are not anywhere near that stage, so you have to work at the different stages that people are at and respond accordingly. But if we can do that, then we're providing people with we're giving them the capacity to be able to support themselves into the long run if we can support the kind of a transition kind of programs like that, and those things do work. I just want to answer one point about the point that Senator Burke mentioned about the the overcapacity in Cork and so forth. And the difficulty is that when you do have people with complex issues and you have not enough beds and too many people in terms of demands looking for beds, you end up with people on the streets. That's the reality. The answer to it is the prioritisation of people who are in homeless services for move-on accommodation. And the difficulty at the moment is that there's a dearth of accommodation. Now, there's been some movement, but the fact is demand is outstripping supply, and even with the move-on, it's actually we're running to stand still, effectively. In terms of dealing with it, the only way we can deal with this is the provision of social housing, where we talk about bed sits and stuff like that. But the difficulty with that stuff is that we're reacting to events. We've already had those problems, and we decided to move away from those. What we need to do now is we need to plan our response. Now, these things take time. Niamh mentioned the low-hanging fruit. We need to move to those. If we can bring what is out there back into play quickly, then that's one way of dealing with it. But in the long run, we've got to deal with this comprehensively. The other thing about lifelong adaptable housing, if people are living in their own areas and they're in their own communities, they are strong communities. If somebody moves in terms of life changes, then they should be able to move within those areas. So any new builds need to incorporate the lifelong adaptable housing for people so they can move up and down depending on the life cycle. So we need to comprehensively think this through, you know. And Austin mentioned it as well. Lots of the people that we work with, vast majority are single people that we work with at the moment, but the vast majority come from areas of high social deprivation. We have to deal with the issues of poverty and income and the housing. 7% of housing here, we need at least 20% of social housing in this country to make this system work, and that would help immeasurably to recalibrate the rents and the spiralling rents and so forth. So one thing has a huge impact on the other, and we need to connect the dots in this.
Thank you very much. I'd just like to